My legs/ankles/feet don't look great, but I don't feel pain. Can I still have PAD?
Yes, you can have PAD, even severe PAD, without pain. Why is that? How is that? It has to do with diabetes. Not all patients with PAD have diabetes, and not all diabetic patients will get PAD. However, there's a strong correlation between those two. Most patients with PAD do have diabetes, and a lot of patients who have diabetes long-term will develop PAD. Let's talk about diabetes for a second. Diabetes is a disease of chronically elevated blood sugar that the body and the pancreas and the hormone insulin cannot handle. Elevated blood sugar all the time is toxic to the body. It's toxic to the blood vessels, the arteries namely. It's toxic to the eyes. It's toxic to the nerves. In the context of the nerves, long-standing diabetes causes something called peripheral neuropathy. It damages the nerves. And as you know, nerves are what transmit pain signals to us. If I put my hand on a hot stove, I'll immediately feel pain and I'll pull my hand away. That's the body's natural reaction. If I didn't feel pain, I'd rest my hand on there and it would melt all the skin off my hand. So pain is a good thing because it tells us when there's something wrong. And it's generally a good barometer. If something's wrong, stop doing that. However, patients with diabetic neuropathy or peripheral neuropathy, their pain signals are often dulled or completely gone because their nerves are damaged. So they don't feel pain in the way that normal people without peripheral neuropathy do. So you could have peripheral arterial disease, severe peripheral arterial disease with tissue damage, bad ulcer, tissue necrosis, dying tissue, and you could theoretically not feel any pain. And this isn't that common, but it is. We've seen it. I've seen it. I've seen patients with long-standing diabetes and PAD. They come in, they have a purple toe, it's dead tissue. Unfortunately, we can't help them anymore. It has to be amputated. And I ask them, like, why did you wait so long? And I try not to be accusatory because it's not their fault. And they answer me, Doc, I didn't feel any pain. They had such severe peripheral neuropathy from their diabetes that the pain signals weren't coming up. So you can have PAD, even potentially severe PAD, without pain because of the presence of neuropathy and damage to the nerves. That being said, most patients do feel pain, and pain is one of the big indicators. Leg pain without any other obvious cause is one of the big indicators of PAD. It's one of the two big indications to refer to us so we can evaluate the patient. Wounds on the legs, ankle, or feet that aren't healing or slow to heal, and pain without any other cause. Those are the two big indications of PAD to refer to us. Remember, when you refer to us, we're not going to go straight to procedure. We're going to do a 7-point evaluation on the patient. H&P, photographs of the legs, ankles, and feet. Pedal pulses check. Walking impairment questionnaire, handheld Doppler, ABI, duplex arterial ultrasound. Comprehensive evaluation to see whether there's PAD, how bad it is, what locations, and if the patient meets the criteria for procedure or not. If the patient does, we'll schedule them for procedure and we'll revascularize them, and we'll almost certainly restore blood flow and make them better. And you're going to get a note for the same. So, wounds and/or leg pain are the indications. That being said, there's an asterisk by the pain part. There may be situations where pain is not present, but there's still severe PAD. Those patients should also be referred. And the reason for that is severe peripheral neuropathy often dulls or eliminates the sensation of pain.